That deals again with bird flu. Now, how well will antiviral medicines work against pandemic influenza? They have helped people with other types of influenza feel better, get better, decrease their symptoms, so they're not sneezing as much, so they're not offering the opportunity to spread the illness as much, so they do have an impact. I can tell you that people were buying the antiretrovirals off the shelf when this hit, and so there's going to become an availability problem too if it becomes widespread. It helps to treat and prevent influenza it has helped for many years. It keeps the virus from reproducing in the body, so it keeps your viral load low, so you don't feel as bad, so you're able to ride it out and don't get as ill. Now, how much antiretroviral medicine is available? The national supply has enough antiviral medicine to treat 2.2 million people. That's not even the city of Atlanta. Now, they are currently trying to increase the supply, and the national goal is to have enough antiviral medicines to respond to major outbreaks. And it's given out by prescription only. So, you're going to have to go to the doctor, you're going to have to get a prescription for it. And it does cause some serious side effects in some folks. And so it's going to be a concern of you can't just overuse this as well. How should antiretroviral medicines be dispensed in an emergency? Again, they're in the planning phase. I said, I think before a couple of you got here, in July, CDC had they had a lot of news coverage about a meeting they were having with national leaders to decide how should not only vaccines but antiretroviral medicines be allocated should there be a pandemic. Now, there has not been a report from that meeting released yet, but that's what the meeting was about. And generally what has been put on the website since that meeting is some of the same information that was there before, that the same populations that were advised to get the flu vaccine are going to be the priority groups to get the vaccine and antiretroviral medicines. And that just talks about that meeting. The other interesting thing about that meeting is, I know a couple, I know the person who is the health director for the AME denomination. She wasn't included in that meeting. So I'm just wondering, who were the national experts that were asked to answer this very important question? Now, they have not released a list of who all attended that I could find yet, but I am very much looking forward.
There's a lot of politics involved.
Absolutely.
And politics and economics and so on, and national experts. It's kind of like a club.
Absolutely.
And few of us have access to that. This is a problem across.
Absolutely. It's a problem in many aspects of government funding, opportunities for jobs. I mean, just a tremendous impact because we are not at that table. And that's what we want to talk about is how do we get faith leaders at that table so that we can be sitting at that table in deciding who should be first responders. And we all know first responders are going to be the first vaccinated. They're going to be the first to get antiretrovirals. They're going to be the first to make sure that their family has, once people start hoarding food and things, they're going to be the first to make sure that they have the needed supplies. Those things are all going to be reserved for that group of lucky folks that are considered first responders. Now, how do we get clergy and church leaders to be in that group? That's the question. Now, the answer to that question that's listed there is really, we don't know. They're hoping that they can get it down to less than a year to produce a vaccine, but right now that's the standard. How safe will the vaccine be? Now, the position the CDC is taking this point is The influenza vaccine cannot give you influenza. Before being used, new vaccines pass monthly safety tests, and FDA administration and manufacturer review safety findings before approving vaccines. But again, as I told you before, this step has been suspended. In the case of a pandemic, this step can be prevented to get vaccines to the market. Now,
I'm sorry. Have they completely suspended safety review of safety findings, or have they just abbreviated?
Now this step is here.
Before being used, new vaccines pass monthly safety. Okay.
Yes.
Right.
Yes, this step has definitely been going on.
Right.
But the actual FDA process, where they may have to have some human trials and other things that takes it a little bit longer to get to market, those have been suspended.
Has that been totally suspended?
Well, it was for a time period. I don't know. They have gone back and forth between suspension and reduction of the process. But a reduction of the process, if you look at what that reduction is, it looks like
that's why I was wondering about that, because there is a certain period of time before that's mandated from the FDA guidelines. And in many cases, to expedite delivery to the market, they will abbreviate the process. They won't totally eliminate it. So just. Well, and I don't know what that's applying to this particular process.
In a case of a pandemic, there is authority in the statute that will allow them to bypass that part. Now, how that has been applied is not really clear. But it is very prevalent on the websites and they are making it very well known. We have the authority to do this should we choose to.
Yeah, the FDA is a very unique agency. And they have the authority to promulgate their own
rules.
And so
absolutely,
they can. So the issue is, an abbreviation, not to be too technical, but in altering these rules, from their usually accepted guidelines or their usually practiced guidelines, how much have they abbreviated, if they haven't eliminated it, how much have they at least abbreviated the safety review process? That's an important factor.
Absolutely.
You don't want to put anything out there without looking at some safety issues. Not all.
Exactly, and I do not mean to indicate that they're not in it. Again, this step, they do have monthly testing. Now, exactly how extensive this step is in regards to this step is, I can't tell you the distinction. Okay. Again, we talked about on the organizations that normally will be in charge in a pandemic, and for the United States, it is U.S. Department of Health and Human Services will be the lead public health agency, and then the DHS will have the ability to appoint a lead federal official assigned, and usually either be the Surgeon General or the head of the CDC that will be assigned to be the lead person in deciding how to respond in a pandemic, and also again working with other international organizations. Now, the media is expected to be a partner in this and to provide urgent information, and we saw that with H1N1. I think most people kind of got inoculated to it, to where it was kind of benign. Every day you saw something about new case, boy dies, and it was something every day for a time about H1N1, and the problem with that is that people kind of get saturated. And one of the questions we want to address today is, what type of messages do you want to receive, and how would you like to receive them? Do you want all your messages to come from media? Or should there be some other way of getting information so that you don't get information overload and so saturated that you just start to ignore it when you hear it? It's not something that will resound with you.